Hi, my name is Hien Sanchez. I'm a licensed clinical social worker, and I work in Region 1, which is mainly the Orleans and surrounding area parishes. So today I want to talk to you about consistent crying and tips about how to support babies and infants and also yourself as an important caregiver in meeting these young children's needs. So how is this relevant today? Well, all babies and children cry. It's their way of communicating when they don't have that language yet. Specifically, they don't have words, and so they communicate by crying. For example, things that they may need are, they are hungry or they're uncomfortable, they're hot, they're cold, or they're sleepy and tired. They can also be uncomfortable with wet or dirty diaper, or they just want or need some connection, nurturance with a caregiver or an adult. They can also not be feeling well, being congested, or even in pain. So, all crying children need soothing, nurturing, and patient caregivers to interact with them so they feel safe and secure in understanding their environment. What are some ways that you can help support babies and infants when they're crying? Obviously, holding the child or being near the child, being with them, with their feelings within eyesight. So you can sing, you can rock them, you can offer a pacifier or a special toy or blanket. You can talk to the child calmly and sympathize with their feelings, just validating their experience of either not feeling well or just trying to even guess what they might be feeling or what's going on for them. Reassuring that the child is safe is also very helpful. Another good tip is that, you can change the environment, going outside for a walk or putting them in an area that's really safe, either their crib, a swing, or a playpen. This is just really especially helpful if you, the caregiver, also need a few minutes to collect yourself, to calm down, take some deep breaths, just get a little moment of break. One thing that is really, really, really important is to never, ever shake a crying baby. That is never appropriate and can actually be very harmful to a young child. So if you ever feel overwhelmed, this may be a time to tag out, get help from someone else, or take a break. Taking yourself in a timeout just for yourself, just to collect yourself and sort of regroup. Now, if the crying is unexplained, or if it has occurred for more than an hour to 2 hours with no breaks, and you as a caregiver, you have checked for possible causes such as pain or discomfort, uh, such as, fever, or are they teething, and, any other attempts to soothe the child has not worked, then it may be time to seek medical attention. And the same can be said about toddlers and older children, this very excessive, consistent crying, that there may be some underlying cause. So just to wrap it up, and thinking about consistent crying, and you just remember it's their form of communicating and telling their caregivers what they need. And it's also important to recognize when you are overwhelmed and know your limits. It is okay. And actually, please do not hesitate to seek help if that is available, or just taking that moment just for yourself for a break. You know. Also, just remember, little ones are figuring out their world and their environment and their own bodies, and that you're there to help them with that, and that you both are learning about each other. And it's through these consistent, nurturing, and patient interactions that's the foundation of building trust and safety and security for young children that promotes their well being and their development. Another reminder is that caregivers, that you are so important. And taking care of yourself is the only way that you can fully take care of others, especially our little ones. So, would you guys, thank you for your time. Take care.